Picture Rachel staring at herself in her doctor's office mirror, watching him explain the ultrasound images on his screen. Polycystic ovaries, he says, pointing to the string of pearls pattern visible on the scan. At 26, she thought the irregular periods, stubborn weight gain around her middle, and the dark hair sprouting on her chin were just bad luck. Now she has a name for it, PCOS, but she feels more lost than ever. Rachel isn't alone in this struggle. She's one of approximately 6 to 20% of women of reproductive age worldwide living with polycystic ovary syndrome. That's potentially 1 in 5 women dealing with this complex hormonal condition that affects everything from fertility to metabolism to mental health. But here's what most doctors don't have time to explain in that overwhelming first appointment. While PCOS can feel like your body has turned against you, there's something incredibly powerful you can control right from your own kitchen. Did you know that eating the wrong foods can actually make insulin resistance, one of the key drivers of PCOS, significantly worse? But here's the empowering truth. The right foods can work like targeted medicine to help balance your hormones, reduce inflammation, and improve insulin sensitivity. I've spent months combing through the latest peer-reviewed research from 2022 to 2024, published in prestigious journals, and backed by institutions like Johns Hopkins, Harvard Medical School, and the National Institutes of Health. What I discovered will change how you think about managing PCOS through nutrition. In the next few minutes, I'm going to share 12 evidence-based foods that can transform how your body responds to insulin, reduce chronic inflammation, and help regulate your hormonal balance. Each one targets different aspects of PCOS, from the insulin resistance that affects up to 75% of women with this condition to the chronic inflammation that drives many symptoms. But stay with me until the end, because the last food on this list might surprise you. It's a simple spice that's probably sitting in your kitchen right now, but clinical trials show it can improve insulin sensitivity by up to 23% in women with PCOS. Most women have no idea it could be their secret weapon for hormonal balance. Are you ready to discover how food can become your most powerful ally in managing PCOS? Before we dive in, here's an important reminder. This video is for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider before making significant dietary changes, especially if you're taking medications like metformin or have other health conditions alongside PCOS. Now, let's dive straight into the foods that can really help manage PCOS, beginning with number 1, fatty fish. Imagine preparing a perfectly grilled piece of salmon, the omega-3 rich oils glistening as they seal in flavor. You're not just creating a delicious dinner, you're consuming powerful medicine for your PCOS. A comprehensive 2022 study published in Frontiers in Nutrition examined 185 women with PCOS and found something remarkable. Women with higher dietary and serum omega-3 fatty acids, particularly the long-chain varieties DHA and EPA found in fatty fish, showed significant improvements in insulin resistance and better body composition. The magic compounds here are eicosapentaenoic acid, or EPA, and docosahexaenoic acid, or DHA, which work by reducing chronic inflammation and improving how your cells respond to insulin. A 2023 systematic review published in the Journal of Ovarian Research analyzed 9 randomized controlled trials involving 591 PCOS patients. The results were impressive. Omega-3 supplementation significantly improved HOMA-IR scores, a measure of insulin resistance, by minus 0.80 points and increased beneficial adiponectin levels. Do you currently include fatty fish in your weekly meal plan? Aim for at least 2 servings per week to tap into these hormonal benefits. Next, food. Number 2, leafy green vegetables. Picture yourself washing fresh spinach leaves, each one packed with magnesium, folate, and phytonutrients that your PCOS body desperately needs. According to Johns Hopkins Medicine's 2024 clinical guidelines on PCOS diet, leafy greens are foundational foods that should form the base of a PCOS-friendly eating pattern. These vegetables are rich in magnesium, a mineral that many women with PCOS are deficient in. Magnesium plays a crucial role in insulin sensitivity and glucose metabolism. The high fiber content, averaging 2 to 4 grams per cup, helps slow glucose absorption and prevents those insulin spikes that worsen PCOS symptoms. The folate content supports healthy hormone synthesis, while compounds like chlorophyll provide anti-inflammatory benefits. Which leafy greens do you enjoy most? Share your favorites in the comments. Next, food number 3, berries. Imagine reaching for a handful of deep purple blueberries. Their rich color signaling the presence of powerful anthocyanins that can help regulate your blood sugar. Recent research on anthocyanins, the compounds that give berries their vibrant colors, shows promising results for insulin sensitivity. A 2024 study published in Nutrition and Diabetes found that the anthocyanin cyanidin 3O glucoside significantly improved glucose consumption and glycogen synthesis in insulin-resistant cells, effectively reducing insulin resistance. A comprehensive 2023 meta-analysis in Frontiers in Nutrition, examining randomized controlled trials, found that anthocyanin supplementation significantly reduced fasting plasma glucose, insulin levels, and HOMA-IR scores in patients with metabolic disorders. The key compounds are cyanidin, delphinidin, and malvidin, which work by improving insulin signaling pathways and reducing inflammation. Berries also have a low glycemic index, meaning they won't spike your blood sugar. 1 cup of raspberries provides 8 grams of fiber while keeping net carbs low. Do you include berries in your breakfast routine? They're perfect additions to Greek yogurt or eaten fresh as snacks. Next, food number 4, avocados. Picture cutting into a perfectly ripe avocado, that creamy green flesh rich in monounsaturated fats that can help improve your insulin sensitivity. Avocados are nutritional powerhouses for PCOS management. They're rich in oleic acid, a monounsaturated fat that has been shown in research to improve insulin sensitivity and help with weight management, particularly important since obesity affects 60 to 80% of women with PCOS, according to recent studies. Each avocado provides about 14 grams of fiber, which helps slow glucose absorption and keeps you feeling satisfied longer. They're also rich in potassium, more than bananas, which supports heart health, important since women with PCOS have increased cardiovascular risks. The healthy fats in avocados also support hormone production and help your body absorb fat-soluble vitamins like vitamins A, D, E, and K. Are you team avocado toast, or do you prefer them in smoothies? Let me know in the comments. Next, food number 5, nuts and seeds. Imagine sprinkling a tablespoon of ground flax seeds into your morning smoothie, each tiny seed packed with lignans that can help balance your hormones. Nuts and seeds are particularly valuable for women with PCOS due to their unique nutrient profiles. Walnuts contain alpha-linolenic acid, a plant-based omega-3 that helps reduce inflammation. Flax seeds are especially beneficial because they contain lignans, plant compounds that can help modulate estrogen levels and improve menstrual regularity. According to a 2024 research review, flax seeds contain secoisolary-cyresinol diglucoside, which has been shown to help regulate hormone levels in women with PCOS. Chia seeds provide both omega-3 and an impressive amount of fiber, about 10 grams per ounce. A small handful of mixed nuts, about 1 ounce, provides healthy fats, protein, and minerals like magnesium and zinc, which support insulin sensitivity. Which nuts or seeds do you reach for when hunger strikes between meals? Next, food number 6, Greek yogurt. Picture opening a container of thick, creamy Greek yogurt, rich in protein and beneficial probiotics that support both your gut health and hormone balance. Greek yogurt deserves special attention for PCOS management due to its high protein content, about 20 grams per cup, which helps stabilize blood sugar levels and keeps you feeling satisfied longer. The protein helps slow the absorption of any carbohydrates you eat with it, preventing glucose spikes. Recent research published in 2024 has highlighted the importance of gut health in PCOS management. The probiotics in Greek yogurt, particularly lactobacillus and bifidobacterium strains, help support a healthy gut microbiome. Studies suggest that women with PCOS often have altered gut bacteria, and probiotics can help restore balance. Always choose plain, unsweetened varieties to avoid added sugars that could spike insulin levels. You can add berries or a drizzle of honey if you need sweetness. Do you include probiotic foods in your daily routine? Your gut and hormones will thank you. Next, food. Number 7, sweet potatoes. Imagine the aroma of roasted sweet potatoes filling your kitchen, their natural sweetness providing steady energy without dramatic blood sugar spikes. Despite their sweet taste, sweet potatoes have a moderate glycemic index and provide sustained energy. They're rich in beta-carotene, which your body converts to vitamin A, potassium, and fiber. The fiber content, particularly pectin, has been shown in research to help improve insulin sensitivity. Sweet potatoes also contain anthocyanins, especially purple varieties, and other antioxidants that help combat the oxidative stress that's elevated in women with PCOS. The potassium supports cardiovascular health, which is important since PCOS increases heart disease risk. The complex carbohydrates in sweet potatoes provide steady energy without the blood sugar roller coaster that comes from processed carbs. What's your favorite way to prepare sweet potatoes? Roasted, mashed, or baked? Next, food number 8, eggs. Picture whisking fresh eggs for a protein-rich breakfast that will keep your blood sugar stable for hours. Eggs are complete proteins containing all essential amino acids, making them excellent for blood sugar stability. Recent research from 2024 shows that protein-rich breakfasts can significantly improve insulin sensitivity throughout the day in women with metabolic disorders. A 2021 systematic review found that eggs, when consumed as part of a balanced diet, can be beneficial for women with PCOS. They provide high-quality protein, about 6 grams per egg, which helps with satiety and muscle maintenance, important for managing insulin resistance. Eggs are also rich in choline, which supports brain health and hormone production, and contain lutein and zeaxanthin for eye health. They're naturally low in carbohydrates, making them ideal for keeping blood sugar stable. The key is preparation. Avoid frying in unhealthy oils and pair with vegetables for a complete PCOS-friendly meal. How do you prefer your eggs? Scrambled with vegetables, hard-boiled, or in an omelet? Next, food number 9, quinoa. Imagine fluffy, perfectly cooked quinoa, each tiny grain offering complete protein and steady energy without spiking your blood sugar. Unlike many grains, quinoa is a complete protein containing all 9 essential amino acids. This makes it particularly valuable for women with PCOS who need steady protein intake to support insulin sensitivity. Quinoa has a lower glycemic index than rice or pasta, making it a smart choice for blood sugar management. Research shows that replacing refined grains with whole grains like quinoa can improve insulin sensitivity. Quinoa is also rich in magnesium, a mineral that many women with PCOS are deficient in. Magnesium plays crucial roles in insulin function and glucose metabolism. The fiber content, about 5 grams per cooked cup, helps slow glucose absorption and supports digestive health. The saponins in quinoa, which give it a slightly bitter taste if not rinsed, actually have anti-inflammatory properties. Have you experimented with cooking quinoa? It's incredibly versatile in both sweet and savory dishes. Next, food number 10, dark chocolate. Here's where things get interesting. Imagine breaking off a square of rich dark chocolate with at least 70% cacao, letting it melt slowly on your tongue while knowing it's actually supporting your hormone health. Before you think this sounds too good to be true, listen to the science. Dark chocolate contains flavonoids, particularly epicatechin and catechin, which have been shown to improve insulin sensitivity and reduce inflammation. A 2023 study found that moderate consumption of high cacao dark chocolate improved endothelial function and reduced oxidative stress, both important for women with PCOS. The key is moderation. Think 1 or 2 squares, and choosing chocolate with minimal added sugar. Dark chocolate also contains small amounts of magnesium and can help satisfy sweet cravings in a healthier way than processed desserts. The flavonoids help improve blood flow and may support cardiovascular health. The operative word here is dark and moderate. We're talking about a small daily portion of quality chocolate, not a candy bar binge. Which of these foods have you been avoiding that you might reconsider now? Next, food number 11, turmeric. Picture the golden powder of turmeric transforming your meals into anti-inflammatory medicine, its earthy aroma promising hormonal healing. Turmeric contains curcumin, one of the most extensively researched anti-inflammatory compounds in nutritional science. Multiple studies have shown curcumin's ability to improve insulin sensitivity and reduce inflammatory markers in women with metabolic disorders. Curcumin works by inhibiting inflammatory pathways, particularly nuclear factor kappa B, a protein complex that regulates inflammatory responses. For women with PCOS, this means reduced chronic inflammation that contributes to insulin resistance and hormonal imbalances. For optimal absorption, always combine turmeric with black pepper, which contains piperine, and a healthy fat like coconut oil. This can increase curcumin absorption by up to 2,000%. Fresh turmeric root is even more potent than powder, but both forms are beneficial when used regularly in cooking. Do you cook with turmeric regularly? It's fantastic in curries, golden milk, and even roasted vegetables. Next, food number 12, cinnamon. And here's our surprise winner, that simple spice sitting in your kitchen cabinet that could revolutionize your PCOS management. Multiple clinical trials have demonstrated cinnamon's remarkable effects on insulin sensitivity in women with PCOS. A 2017 randomized controlled trial published in Phytotherapy Research found that women with PCOS who took 1.5 grams of cinnamon daily for 12 weeks experienced significant reductions in fasting insulin levels and HOMA-IR scores, measures of insulin resistance. The research is impressive. A 2023 umbrella meta-analysis published in Diabetology and Metabolic Syndrome, which analyzed multiple studies, confirmed that cinnamon supplementation significantly reduced fasting plasma glucose, insulin levels, and HOMA-IR in women with PCOS and type 2 diabetes. The active compounds, cinnamaldehyde and procyanidin type A polymers, work by mimicking insulin action and improving glucose uptake by cells. Essentially, cinnamon helps your cells become more sensitive to insulin. A pilot study found that cinnamon extract improved insulin resistance in women with PCOS to levels similar to age-matched women without PCOS. Another study showed women who received cinnamon had more regular menstrual cycles, 3.82 cycles, during a 6-month trial compared to 2.2 cycles in the control group. Here's a crucial detail. Ceylon cinnamon is superior to cassia cinnamon for daily consumption because it contains much lower levels of coumarin, which can be harmful in large amounts with regular use. Type yes in the comments if you found this information about cinnamon surprising. Let's recap these 12 scientifically backed foods that can become your allies in managing PCOS. Omega-3 rich fatty fish that reduce inflammation and improve insulin sensitivity, magnesium-packed leafy greens, antioxidant-rich berries with their insulin-sensitizing anthocyanins, hormone-supporting avocados with their healthy fats, nuts and seeds rich in beneficial oils and lignans, probiotic-rich Greek yogurt, fiber-filled sweet potatoes, complete protein eggs, insulin-friendly quinoa, antioxidant-rich dark chocolate, anti-inflammatory turmeric, and our surprise winner, insulin-sensitizing cinnamon. But here's your bonus tip. Backed by cutting-edge 2024 research from Mass General Brigham, Meal timing matters as much as food choices. Recent studies show that eating your largest meal earlier in the day, before 3 p.m., when your circadian insulin sensitivity is naturally higher, can significantly improve glucose metabolism in women with PCOS. This aligns with your body's natural rhythms and can amplify the benefits of all these foods. Your circadian rhythm directly affects how your body processes glucose and produces hormones. Front-loading your calories earlier in the day, when insulin sensitivity peaks, could be a game changer for managing your symptoms. Remember Rachel from the beginning? She started incorporating these foods into her daily routine, focusing on omega-3 rich fish twice a week, adding berries to her Greek yogurt breakfast, and sprinkling cinnamon on her morning smoothies. 6 months later, her periods became more regular, her energy levels stabilized, and her latest labs showed improved insulin sensitivity. Food truly became her medicine. Living with PCOS can feel overwhelming, but you have more power than you realize. Every meal is an opportunity to support your body, reduce inflammation, and improve insulin sensitivity. These aren't just foods, they're tools in your healing toolkit, backed by rigorous scientific research from institutions like Johns Hopkins, Harvard, and the NIH. Your body is incredibly responsive to good nutrition. Be patient with yourself as you make these changes. Start by adding 1 or 2 of these foods to your daily routine, then gradually expand from there. I want to hear from you. Tell me which country you're watching from and which of these foods you're most excited to try. And if you're dealing with PCOS, remember, you're not alone. This community is here to support each other. If you want me to create a follow-up video about foods to avoid with PCOS, or if there's another health condition you'd like me to cover with this same evidence-based approach, let me know in the comments below. Remember, knowledge is power, but applied knowledge is transformation. Take what resonates with you from this video and start implementing it today. Like this video if it helped you understand how nutrition can support PCOS management, share it with someone who needs this information, and subscribe for more research-backed health content. Your support helps me bring you more evidence-based videos that can genuinely improve your health. Until next time, remember, your health is your wealth, and every healthy choice you make today is an investment in a better tomorrow.